your health tonight, the pandemic was declared officially over by the federal government in May. And while many are eager to move past the virus's grip on the world,
health leaders still believe that millions are suffering from long COVID, and they're going to be doing so for years to come. KRON 4's Noelle Bellow gives us a look now at what we know so far about long COVID's long list of symptoms.
Long COVID is not one thing. It's not only brain fog, it's not only fatigue.
Doctors and researchers across the country are currently conducting studies on the wildly uncertain long COVID. The condition can present itself in more than 200 ways.
We now know that the typical features of long COVID include fatigue. People come back to the clinics complaining of fatigue, being lack of energy, sort of tired all the time, et cetera, et cetera. But long COVID is much, much more broader than this and can literally, and if you follow the symptomatology of long COVID, you have wide-ranging symptoms, wide-ranging problems in nearly every organ system.
Dr. Zayed Al-Ali is chief of research at St. Louis Healthcare System. He's working to determine the risk of long COVID within the population.
Blood clotting in patients, we see heart problem in patients, strokes in patients. We see in some cases increased risk of diabetes as a result of having COVID-19 infection. So it's really much, much more than brain fog and fatigue.
As of February 2022, long COVID was estimated to affect about 16 million adults in the United States, often arising in otherwise healthy young people, and is even possible after a mild initial infection. The risk appears at least slightly higher in those who were hospitalized for COVID and in older adults. Women and those at socioeconomic disadvantages also face higher risk.
We don't really know from a physical perspective why people get the symptoms they get.
UCSF Dr. Kim Rhodes is one of the leaders of a team of researchers here in the Bay Area working on a study called Let's Figure Out Long COVID. The study aims to answer several questions.
What we're trying to find out and trying to understand better is what is COVID doing inside of our bodies? Are we carrying residual virus? Is our immune system just on hyperdrive even though there's no virus there and attacking itself? What is driving long COVID?
The study's funded by the National Institutes of Health. Researchers are working to make sure it's inclusive and are focused on communities who have experienced higher rates of infections, hospitalizations, and deaths.
We literally got our inspiration to look at long COVID from the patient community, from the people who really started being affected with COVID and not recovering. So always listen to the patient. This is really the big lesson here.
At this time, long COVID remains shrouded in uncertainty, but studies like these are the best way to gain answers those suffering are seeking. Noelle Bellow, KRON 4 News.